Hello, thank you for joining me on this webinar. And today I want to be talking to you about what Sever's disease really is and how you can remove it. My name's John, I'm a head therapist here at John W Sports Injury, and we specialise in working with adolescent athletes. And as a result, Sever's disease is about one of the most common conditions that we see, and it's really frustrating when people are given misinformation, miseducation about what this condition is. What I want to do is spend the next 10 to 15 minutes just advising you on what the condition actually is and how you can be helping your child return to the sport and exercise that they love to do. Across the course of the webinar, we are going to be talking about what Sever's disease actually is. I always think the term Sever's disease sounds much more dramatic than it really is. It sort of it implies some fear or creates fear around the condition. But the key for me is actually understanding what it actually is and the process that needs to be addressed in order for you to truly remove Sever's disease and allow your child to return to that sport and exercise that they love. Well, firstly, who am I? I should explain. My name's John White. As I said, I started John W Sports Injury, as you can see there, back in 2007, following degrees in sports and exercise science and sports rehabilitation. We now have 3 sports injury clinics. We're based in the Bromley and Orpington area, just outside of London. We're sort of southeast London, Kent Way, in the Bromley and Orpington area. And we specialise in working with adolescent athletes. And as a result, Sever's disease is probably about the most common condition that we see and we work with here at our clinics. There's some pictures of our clinics and the team of therapists that we have here. So what I want to do is just to debunk some myths for you. Sorry, I realise I'm covering up that top one, but that first one there is that Sever's disease is not just growing pains. I want to talk about this because this is something that I hear all the time. And even parents just admit to me, they say, I just thought it was growing pains. We have this term out there, but I actually hate this term. I think that it doesn't give respect to the conditions and to your child. We don't do that with other injuries, so I don't believe we should do that with Sever's disease, which tends to be grouped into this growing pains. It doesn't give the information that we need in order to truly address it. It's not just best to play through them. It's not just best to suffer that pain, and your child, because it's a growing pain, will just grow through it. But it also does not mean that you have to spend a huge amount of time away from sport and exercise. It does mean that we can address this when we understand this and get your child back much quicker than they would do. So what we do know, it's a condition in its own right, as with any other injury. If we have an Achilles tendon problem, a knee ligament issue, a hamstring tear, that's an injury that we understand and we rehabilitate that appropriately. Sever's disease is exactly the same. We need to understand the condition and we need to provide a personalised rehabilitation program in order to fully restore back to normal working life and sport and exercise for your child. Now, I've mentioned not to term it growing pain, but it is a growth-related condition. So what I mean by that is every child in every case will be different. You know, it's very difficult for us to answer, when can my child return to sport? Because everybody will have a different case because it's related to nature. It's related to how your child is going through adolescence. So as a result, it deserves the individual care and attention that your child really deserves. So what is it? Well, Sever's is a condition where the area at the base of the heel creates inflammation and soreness. So typically children feel that pain at the back of their heel and it becomes very sore, very problematic. This is an area that we call the calcaneal apophysis. It is a growth plate. So in your child, the back of the heel is the area where the bone grows. So it's a soft structure, terms cartilage. The bone then grows as they go through adolescence, and when it's finished growing, it turns to bone. So it's a good thing. It's a good thing that it's cartilage. It allows for bone growth. The problem is we have some strong muscles that attach into that heel that if we put too much force on that area, because it's soft, it doesn't withstand that force too well and it become very inflamed, very sore. And what we might typically see is children not being able to put their foot down onto the floor or very sore in their heels or back of the ankles when they're running. So we've got a diagram of it here, what's happening. So if we look at this, you can see that we've got this calcaneus, which is the heel bone, and we've got this area here, which is a growth plate. But you can see that this tendon comes right the way down and attaches into there. So if we're using these muscles and we're developing too much dysfunction in these muscles via the Achilles tendon, that pulls on that growth plate and that causes the soreness. And that's why your child is getting that pain in the back of the heel. So how people treat it wrong? Well, what they do is they treat the cause, but what we need to do is we must treat the effect and the cause. What I want you to do, and what I often describe this, is think of a bully in a playground. Okay, so we've got a scenario where we have a bully in a playground and a child that's being bullied and becoming very upset. So the child being bullied is the heel, the growth plate area, and the bully is the muscles. Now what we can do is we can take the child out of the playground. Now that would just be treating the heel area, perhaps with rest or ice. Now what that will do is that will settle the situation down, but we need to put that child back into the playground, back to the sport and exercise that they love to do. What's going to happen? Well, the bully's going to get back to work and we get the problem again. Okay, so what we need to do is, yes, we need to look after the child, we need to look after the heel, but we must correct the bully so that when the child comes back into the playground and back to the sport and exercise they love, these two things can work in harmony and not cause those problems. I hope that helps to get a better understanding of perhaps what's happening at the condition and why we must be treating it with an individual approach. And for this reason, we cannot just rest. We cannot just take the child out of the playground. That's as soon as they come back in, no matter how long rest they have, the bully's still going to be there. But we can't also just ask them to play through it. We can't just leave the child and the bully together and expect this situation to resolve itself. So what do we actually need to do? Well, we need to calm the symptoms. Yes, we need to settle that heel pain. We need to make the child happier. So this may mean taking them out of sport and exercise for a period of time. But during that time, that's not enough to do, is the point I want to make, because we need to make sure that there's not going to be excessive force applied to that area, that calcaneal apophysis or heel area, once they return. So we need to make sure that those muscles that affect the area are both flexible and that they're strong enough for the demands that your child will be placing upon them. So that's what's absolutely imperative, that we're treating both the effect and the cause. So when it comes to Sever's disease, we have these three big players. We have what we term the gastrocnemius, which is what we know as the calf muscle. Soleus, a muscle slightly less known, but this muscle sits beneath the calf bone and uses that Achilles tendon. So these two muscles come in and they attach into the heel. Now looking further afield, because it is important to do that, the hamstrings can also be a big contributor, because the hamstrings live on the back of your child's legs above the calf area. But if we've got a problem there, they're all connected up, what we call your posterior chain. And if there's a problem anywhere through these big three players, that can cause that problem at the attachment point at the heel. So what we do to help hundreds of children return to sport after Sever's disease, well, we've developed a unique program. And in this program, what we want to do is conduct a series of flexibility and strength tests to understand about the flexibility and the strength of those big three players. Then what we look to do is progressively develop your child through the program in order to remove these restrictions. If they're weak in any of the areas, we look to strengthen them. If they're tight in any of the areas, we look to release them. And this allows your child to then safely return back to the sport once we know that they fulfilled that criteria, in order that we know that there's not going to be excessive force played on that calcaneal apophysis or that heel area. So we are available to help you. How do we do this? Well, what can you expect? As I said, we have 3 clinics. We are based in the Orpington and Bromley area, just outside Kent, but we also have our virtual clinic where we join people in the way I'm joining you now via the internet, and we go through this program. So no matter where you are, we can help you. We will meet with you and we will explain exactly what Sever's disease is. Hopefully I've helped you during this webinar to get a bit more of an understanding about that. But what we want to do is allow your child to understand what is causing their Sever's disease. Now remember, this affects anywhere up to about 20% of adolescent athletes. So lots of children get this, but no two children's case may be the same. It may be a problem with the gastrocnemius, the soleus, the hamstring. They may be tight, they may be weak, or a combination of any of those things. And that's why it's not fair to just give this generalized way of overcoming it. We need to truly understand how it's affecting your child. We'll conduct our tests to establish specifically what is causing your child's Sever's disease. We will then be providing manual treatment. So if you're in clinic with us at one of our clinics, that's us applying soft tissue massage, soft tissue manipulation, in order to be looking and correcting these dysfunctions. If you're joining us virtually, what we do is we go through that with you and we coach you in how you can be applying these techniques to improve the tissue. We will establish the stage that your child should come into the program. So again, some children are unable to weight bear, unable to walk, and we start them at the beginning of the program. Other children may get a little bit of heel pain at the end of their sport, and they may be able to start at a later stage. Again, but what we're looking to do is really apply this individual approach in order to help your child overcome their Sever's disease. And I keep emphasizing the there, but we want this individual approach because we're dealing with a condition here that is created by nature. So we all grow at different rates, so no two child's recovery will be the same. And it's important in our rehabilitation program that we're applying that principle for your child. And following any appointment, your child will be sent a personalised rehabilitation program, which will have pictures and videos for them to follow as part of their program. And we will also provide you follow-up appointments if and when required to ensure a full recovery. So we can be progressing them through the program and we can be making sure that they are following in the way that they should be. So what we want to do, well, we want to help you start your journey to recovery today. So you'll see some of the links below, but you can check us out at www.johnwsportsinjury.co.uk, where what you can look to do, if you think this is going to be of help for you, of help for your child in order to get back to doing the things that they love, you'll be able to book an appointment at one of our clinics or our virtual clinic, where we will be thrilled to get to work with you and your child in order to help them get back to the sport and exercise that they love. If you have any questions, please do feel free to reach out to us.